This station is designed to test a candidate's ability to provide both basic and advanced airway management to a pediatric patient under 2 years of age. The patient in this scenario is apneic, but with a pulse and no injuries, so cervical precautions are not necessary. Candidates do not have a specific time to complete the station.
Candidates at this station are required to sequentially demonstrate initial simple airway and ventilation maneuvers and then successfully intubate the mannequin. This is a non-trauma station, so cervical precautions are not necessary. You'll have 3 attempts to place the tube. Oxygenation and ventilation are both desired, so limit your time for intubation attempts. If you cannot place the tube within 30 seconds, go back to the basics and ventilate effectively, and then try to intubate again.
This station requires the candidate to successfully provide ventilation, oxygenation, and intubation. Equipment at this station includes a pediatric airway mannequin, bag mask device, supplemental oxygen, airway adjuncts, and intubation supplies, as well as personal protective equipment. The main sections of this station are basic airway management, bag mask ventilation, supplemental oxygenation, equipment preparation, and the intubation procedure.
You are now at the Pediatric Ventilation Station. This is a non-traumatic station. No C-spine precautions will be required. Remember that this is a BLS and ALS airway station. You will have at least 3 attempts to successfully intubate the infant. You must ventilate at least 30 seconds with each adjunct provided. You have had time to check your equipment. Do you have any questions?
No, I'm ready to proceed.
Very well.
Okay. I would utilize BSI, gloves, goggles, and mask. I would open the airway and insert an appropriately sized oral adjunct.
No gag reflex is present. The patient accepts the adjunct.
Okay.
Ventilation is being performed without difficulty. The current pulse oximetry is 85%.
Okay. I would put them on 100% O2, 15 liters a minute.
Breath sounds are present and equal bilaterally. Medical control has now ordered intubation.
Okay. Would you take over bag valve mask ventilations and pre-oxygenate the patient? I would begin to check and prepare my equipment. Select a straight blade, make sure the light works, it's tight. Select the appropriate size tube. Lubricate the tube. I'm ready to intubate. Place some padding under the shoulders. Visualize the tube going through the cords. Would you hold the tube for me at the lips? Listen for lung sounds. Listen for sounds over the epigastrum.
With proper tube placement, what would you expect to hear?
positive lung sounds and no sounds over the epigastrum. And after this, I would go ahead and secure it in place with tape.
Is there anything else you'd like to add?
No.
Okay, the station is complete. Thank you.
Thank you.
Begin the station by indicating that the proper personal protective equipment is being used. Start as if you have already determined that the patient is apneic. Open the airway and insert an airway adjunct, such as an OPA. Maintain a good seal and begin ventilation at a rate of 20 to 30 breaths per minute. Watch for the chest to rise and fall. Use the oxygen tubing to attach the bag mask device to the oxygen delivery system. Adjust the flow rate to 15 liters per minute. Continue providing ventilation at the proper rate and volume. Direct the examiner to take over ventilation while you prepare the intubation equipment. With the equipment check complete, position the child's head in a neutral or sniffing position. This is best accomplished and maintained by placing a folded towel under the child's shoulders. Insert the laryngoscope blade, displacing the tongue until the vocal cords are visualized. Introduce the uncuffed tube and advance it to the proper depth. Auscultate bilaterally over each lung and the epigastrium to confirm proper tube placement. You may use an additional method to confirm tube placement, such as attaching an end-tidal CO2 device and then secure the tube. The examiner checks the candidate's performance against the critical criteria for the station. The critical criteria for this station that would have resulted in failure were failing to take or verbalize the use of body substance isolation precautions, failing to provide initial ventilations within 30 seconds, or interrupting ventilations for greater than 30 seconds at any time, failing to pad the torso to achieve neutral alignment, failing to provide a high oxygen concentration, failing to ventilate at an appropriate rate and with adequate volume with each breath, failing to pre-oxygenate prior to intubation, failing to successfully intubate within 3 attempts, using the teeth as a fulcrum, failing to confirm proper tube placement, and performing a procedure that would be dangerous to this pediatric patient, including inserting the wrong size oral airway or using the wrong size tube or cuffed tube.
This station is generally not problematic for most candidates, but those who fail this station normally do so because they took too long to intubate or failed to intubate within 3 attempts. Be familiar with the particular mannequin you will use at the test site and practice on several different mannequins whenever possible.